Okay, now we're doing Trail Guide to the Body, part 2 of shoulder and arm. So we're going to be learning about these muscles that move the shoulder. Group 3, we're going to discuss the rhomboid major and minor, levator scapula, serratus anterior, your pec major and minor, and your subclavius. Right, let's talk about the rhomboid. There's a major, and if there's a major, there's typically a minor, right? That makes sense. So your rhomboid will specifically be moving your shoulder or scapula. So because of the direction the fiber is going, it's going to adduct, so bring it closer to the center. Elevate, raise the shoulder up, and downwardly rotate the scapula. So it originates on your spinous processes, the little, dinosaur spikes of your spine, on T2 through T5. So that's like middle of the back, all right, between the shoulder blades. That is what houses your rhomboid major and minor. So in this picture, you'll see all the spinous processes that have that, fascia or the tendon of the rhomboid major, and then it runs over diagonally, slightly diagonal to the lower section of the scapula. So it's going to connect on your medial border between the spine and the inferior angle. So, anywhere from the spine of the scapula down to that inferior angle is where the rhomboid major is going to pull. Here's the minor. So we'll go back major, minor. You can kind of see major, minor. The minor is typically the smaller muscle. Doesn't necessarily mean it's below it or anything. That would be supra or inferior, something like that, or sub would be below. So rhomboid minor is just tiny little helper muscle for the rhomboid major. It's also going to adduct the scapula, elevate it, and downwardly rotate it. It's just not the main powerhouse muscle. We're going to have virtually the same attachment points for this, except it's a little bit higher on the spine. So it's going to originate on C7 through T1. So if you were to feel your neck in the back, where your curve starts changing is where C7, there's a lump. C7 is the last of your cervical spine that then goes into your thoracic spine. So that is where this muscle originates. It goes downward at an angle and connects to that medial border of the scapula across from the spine of the scapula. So you'll see that spine of the scapula right on that medial border. So just know that rhomboid major tends to be kind of below. Rhomboid minor is that top part of the scapula. All right. Levator. The levator's action mainly is the name. So if you think of levitating, somebody is levitating, right? They are coming up off the ground. In this case, it is elevating. So levator means to elevate. So if you were to unilaterally contract this muscle, one-sided, it's going to bring that shoulder up, right? It's also going to downwardly rotate, laterally flex the head and neck. So not only does this move the shoulder, this also is a neck flexor muscle. So people who tend to have an elevated shoulder or pain in the neck tend to have tightness in their levator muscle. It also will rotate unilaterally. So when the muscles, both sides bilaterally of the levator scapula contract, it's going to pull the head back into extension. It originates on your transverse processes. Those are, we'll call them the wings of your spine. So you have your spinous process, that are the dinosaur spikes, and your wings, that are the transverse process. So the transverse process of the first through the fourth cervical vertebrae. So it attaches way up here, and you'll see in this picture all the tiny little sections of it connecting from 1, 2, 3 to 4, right? So it originates up here, runs down again almost diagonally like the rhomboids in a way to attach onto that medial border, just a little bit of it here, just a little bit, and then that superior angle. So that way it can pull that shoulder up, right? The serratus. Just think of a serrated knife that has the divots, I guess, so that you can, cut through things. That is the shape of the serratus anterior muscle. So it's got the little serrated, we'll call it, fingerling sections. And each of those sections connects to a different rib, right? So what the heck does the serratus do? It kind of also, in this picture, you can kind of see it's kind of underneath the scapula, right? On the side of the body. Runs a little bit anterior, but it's a side muscle per se, an upper body side muscle. So when it is fixed, when the scapula is fixed and not moving, that's what that means. It will abduct the scapula. So it'll, bring it away, right? Abduct, boop. So protract around the rib cage. Brings it around out of the way. When your scapula is abducted or protracted, it kind of shows more of the rhomboids, right? So you can access those rhomboids a little bit easier because the shoulder blade is out of the way. It also will upwardly rotate the scapula. And here's a confusing one. Those top fibers kind of, will upwardly rotate, but you have something pulling from the back, which will drop your shoulder down. It'll depress your scapula. This muscle also holds that medial border. So remember here, this medial border against the rib cage. So if it's tight, you're not gonna your scapula is not gonna be able to wing when you put your arm behind your back, so that we can get under the scap and get the subscapularis. So when this muscle is tight, it kind of glues that scapula to the back of the ribs, right? When the scapula is fixed, I messed that up before. I meant when the origin is fixed. So when this isn't moving along the ribs, right? Origin here. All right. So when the scapula is fixed, it may act to elevate the thorax during like a really forced inhalation, so it'll help elevate that scapula a little bit. So it's out of the way and you can get a bigger, stronger breath. So this muscle originates on your upper 8 or 9 ribs. So all these ribs, it kind of starts there, and then those fingers kind of branch off and run underneath the scapula, right? You'll see this picture here. They go underneath and connect on that border. So here's your scapula, the back of it. You have your serratus coming this way underneath, making friends with your subscap under here, and then coming around and connecting to that medial border. All right, so pectoralis major. Remember when I said there's a major, there's typically a minor, right? So let's talk about the pec major. There's going to be different fibers as well. We're going to talk about the upper and the lower fibers of the pec major. So the upper fibers, closer to the, higher part of the muscle, are going to adduct the shoulder. So that's going to bring it closer to body, right? Add it back into the main part of the body. It's also going to immediately rotate your shoulder, so it's going to rotate it in and assist in elevation during another forced inhalation. So breathe in real deep. It's also going to assist with that. So that would be all fibers. Now, your upper fibers actually help to flex your shoulder. So if you're having, again, mobility issues in the shoulder, especially with flexion, you're going to want to get into the pecs. But also be mindful when you're working the pecs to not work on a lot of the breast tissue, especially women. You might have to ask permission to get into the pecs a little bit. It might be a sensitive area or a more private area. So always keep in mind, here's the or the clavicle here. And if the clavicle were right above this finger, the width of your hand tends to be a comfortable space for most people to be worked on. If you need to go a little bit lower, which is harder when there's breast tissue, you're going to want to ask permission and explain why you need to go lower to get to some of these pec muscles. Now, we're not going to be massaging the entire breast area, at least not in America, and we're not going to be massaging the nipple area, okay? All right, upper fibers, we got that, the flexion part. It also will horizontally adduct. So you're horizontally out and it'll, so you're out like this, it'll horizontally adduct. So bringing it back horizontally. Those lower fibers of your pecs are going to help to extend the shoulder. So upper fibers might flex, lower fibers extend. Now you're typically not going to be able to get to the lower fibers easily on people, right? Again, we're going to be asking a lot of permission. Typically, it's hard to access with a woman or somebody with a lot of fatty breast tissue. So we just kind of don't really go in that general area unless we're working sideline to kind of get the edge of that, okay? Origin. So you'll see this picture here, all that black section here. It's kind of just hugging the sternum. So when you're doing pec major and minor work, when you're getting into the chest, ask your client's permission to work along those attachment points of the sternum. Those attachment points might become rigid, and if you work on those, it might help that muscle to relax a little bit better. So originates on the medial half of the clavicle, sternum, and the cartilage of your first through the sixth ribs. So as it goes down the sternum, it also kind of connects on the cartilage part of the ribs that then connect to your sternum. And then it runs along down and connects onto something called the crest of the greater tubercle of the humerus. So you remember your lesser tubercle, your bicipital groove, your greater tubercle, right under there is that crest. So that's where it's connecting so that it can actually move the shoulder or that humerus bone. Isn't this exciting? All right. Like I said, when there's a major, there's a minor. Here's the pec minor. So this is going to be deeper to the major. The actions are depression of the shoulder, adduction of the shoulder or scapula, we'll talk about, and downward rotation of the scapula. When the scapula is fixed in a position, that's when it can actually help to elevate the trunk or the thorax during a really quick forced inhalation. It originates on ribs 3, 4, 5. So 1, 2, here's 3, 4, and 5. Starts here. Here's a picture of those attachment points. And then it runs up across. Do you remember that little finger nub called the coracoid process? So you have your scapula, here we go, acromion. Well, this finger-like projection will be the attachment point now for your pec minor. So if you're having pec minor issues, you can kind of do some cross-fiber friction or some compression or deeper work to the attachment point of the pec minor. Subclavius. So this is a tiny, tiny little muscle. that mainly just doesn't do a whole lot. So it helps to draw or depress the clavicle down anteriorly, it says. And then also elevates that first rib. So when you're breathing, it needs to pull that rib kind of out of the way a little bit. So the subclavius will help with moving that rib. Also will stabilize your sternoclavicular joint. So where your sternum, here you go, sternum, and your clavicle joint, right in here, it'll help stabilize that joint so that there isn't dysfunction. Because that's not a joint like you would think of in your shoulder or your fingers. That joint isn't moving a whole lot, so you want to keep it stable so that you don't have issues with that. All right. It originates on the first rib and the cartilage. So here's a picture here, the cartilage of that first tiny little rib. It runs up, and there's going to be that little, remember the picture of the clavicle, if I were looking up underneath it, there's that little groove. So that is called that inferior surface, or the middle 1/3 of the clavicle, right? So that's where the subclavius hangs out. All right, now we're talking about shoulder muscle group number 4. This is the bis, the tris, and the coracobrachialis. So your bicep, I think most people know what a bicep is. This is the muscle when you flex, big strong men, the muscle that they want to look real big and awesome. So this is your biceps brachii. The reason why it's called bi means 2. So that means it has 2 heads, and it's on the upper arm brachii. So break it down if you don't know what it is. Break it down for me. All right, biceps brachii. Action. It flexes the elbow and the shoulder. So if you want to really engage this muscle, you're flexing both together. It also will supinate the forearm because it does have an attachment point on the lower forearm bones, right? So it'll help to supinate. So you have your pronate, it'll help to bring it into a supination. So we have 2 heads. Like I said, we have a short head and a long head. And they have attachment points at different parts of the scapula. So over here, we're going to look at the short head, right? So the short head originates on your coracoid process. So that little finger nub where your pec minor would connect on this side, well, now you have your biceps connecting on that little finger at the end of the nub, right? And then you have your long head. So you have something called the supraglenoid tubercle of the scapula. So break down that word if you don't know what it means. Supra means above. Glenoid cavity. So here's your socket and your ball, right? Supra, above, it's going to be on the upper part of that socket, right? So long head will be originating on the supraglenoid tubercle, okay? Alrighty. Insertion. So those 2 heads are going to kind of come together and have a fattier section of muscle. And then both form a tendon that will connect onto something called bicipital aponeurosis. So this... I had to pause that because my dogs heard something and started barking. Anyhow, so where was I? It inserts onto the tuberosity. So it's a little nubby bone. On the radius bone, so that's this bone, more on the thumb side. Your ulna is on the pinky side. The tuberosity of the radius and the aponeurosis of the bicep brachii. So the aponeurosis, just think of that as a sheath, right, of connective tissue, or in this case, tendon, right? And it just kind of connects right onto your radius bone. This is why it also has some forearm movement, and if it crosses a joint, it's probably going to have some action with that joint. So our first muscle that crosses 2 joints, I believe, So it flexes shoulder and elbow. Tricep. No, bi means 2, tri means 3. So triceps brachii means 3 heads on the upper arm. And also, you have your biceps in the front. Your triceps are going to be the back of your arm. So there's your long head. So we don't have a long and a short. We have a long, lateral, and medial head. Okay. So if we were to use all the heads together, it's going to extend the elbow. So it'll put your elbow into a straight position. If we're just talking about the long head, it's going to extend the elbow, and it's going to adduct that shoulder at the glenohumeral joints. So this joint here, it's going to adduct. Oh, wait, I'm sorry. We have abduction. Adduct the shoulder. Okay. So let's talk about origins. Here's the origins here. Remember when I was talking about the infraglenoid tubercle and the scapula? That means below the glenoid. Hold on. The glenoid cavity here. So you have your long head, which originates there. You have your lateral head, which in this picture is the outside. Medial will be on the inside if you are in anatomical position. So that's how you'd remember that. Anyhow, that lateral side, the lateral head, will originate on the posterior surface of something called the proximal half of the humerus. You're like, what's that mean? Proximal is always towards the heart. Distal is away from the body, right? So proximal, the upper half of the humerus. So that top half of the humerus. The medial head will originate on the posterior surface of the distal half. So one's on the upper half here, and the other is on that distal half here. Then they come together, form their, tendon, run across the shoulder onto the ulna, this side, at something called the olecranon process. Your olecranon process is your elbow, right? So your elbow is part of your ulna bone, all right? And that is where your triceps brachii attaches, so that you have this muscle. When it shortens, it'll bring you into extension of the elbow. This is a fun one. Coracobrachialis. Break down the word. Don't know what it means? Coraco, think of coracoid process. So that's probably telling you that it has something to do with the coracoid process of your scapula. Brachialis, brachii means upper arm. So this is an upper arm muscle that has something to do with your coracoid process. So the actions: flexes your shoulder joint and adducts the shoulder joint. It originates on, surprise, coracoid process. This little nub here. So this is why we need to know what this is. You have not only your pec minor, your biceps, now we have your coracobrachialis that are attaching to this coracoid process. Insertion. Medial surface of mid-humeral shaft. Shaft just means the long part of the bone, yeah. The medial surface would be, if you're in an anatomical position, medial surface of the mid. So we're talking about mid-humerus, middle surface. And that is why it helps with adduction, because it's bringing it back to body, okay? All right, this is bonus, the ligaments and other structures of the shoulder and arm. And we'll go through this with our hands-on, learning how to palpate. I know that we did palpate some structures of the arm, like the clavicle. That's not the arm, but in this case, the clavicle, the scapula, the humerus, the head of the humerus, and we've already done some of that, all right? So get familiar with bony landmarks. Just start, feeling around when you're working or working on someone at school or working on someone at home who is your test dummy for school. Just start, palpating and asking questions like, what does this feel like? Or look up some videos that'll help you with your palpation skills. They will only get better as you do more hands-on touch. Also, get familiar with the major joint structures of the shoulder and arm. Remember, ligaments will keep the bones together. The joints will have a bursa sac that helps with movement and keeps things lubricated so that there's no bone on bone rubbing on each other and causing more issues. And also with time, you're going to want to try to locate some major nerves and blood vessels, lymph nodes that are in the shoulder. Because if we do deeper work or stay on an area too long that may house a nerve or blood vessel or lymph node, we can cause some damage, okay? So we're going to go over these ligaments a little quicker, just so you have an idea of the structures that go along with the muscles, right? So here on the picture on the left, there's a little diagram of triceps, biceps, coracobrachialis. You have some pecs, subclavius. It's kind of just a breakdown of the muscles and how they kind of all like intertwine together. Some parts of muscles are deeper to others, some are superficial. So it's a layer. You don't just have muscles just in one layer. You have like some on top of each other, right? And without proper fascia and lubrication, sometimes those muscles aren't going to glide the way that they need, and that's when we need to go in and do some massage to loosen up the fascia, that connective tissue, to kind of free up some of that movement that might be restricted from dysfunction, either overuse, injury, inflammation, whatever. All right, the picture over here. So this section here, we're looking at basically the axilla or the armpit here. So you have all kinds of nerves. Remember, this intersection and the armpit is an endangerment area. So this is why we don't want to do a lot of pressure in here, because you have nerves and arteries, veins, lymph nodes that aren't listed on here or shown, but tons of lymph nodes in this area. So you don't want to do damage to these major structures of the axilla. All right, here's some sternoclavicular ligaments. So you can kind of see, you don't really need to know all these ligaments to be a massage therapist. Just know that they exist, and ligaments are there to keep things from popping away from each other, right? So it's, like your structure to keep your bones together. So here is a picture of the sternum and parts of the ribs it's kind of cut. You can see kind of the spongy bone, right? So just keep in mind that there's going to be ligaments keeping this all together, right? So the radiate ligament. You have costal cartilages, so that means cartilage in between your ribs, right? Here's some ligament here. That's the costoclavicular ligament. So, it's over here. And all kinds of stuff, right? And if you are very confused on what we're looking at, here's a picture, a circle view of what this is. This is like obviously the zoomed version of it. All right, ligaments of the shoulders. Now remember, ligaments can become torn, and they take a while to heal. We're thinking months, all right? They could take weeks if it's not a very bad tear, but it's typically going to be, it could be months, okay? So we're looking at the shoulder joint, and you can see all this fun connective tissue, the ligaments connecting the bones together. So they're not just all floating around, right? Right. Joints. We already went over what the joints are. This is a view of the shoulder joint. If I were to cut it in half so that you can see kind of more of the inner structure. The main thing I want to show you here is there's something called the subacromial bursa, this right here. That bursa sac, so you have bursa sacs that surround the joints. They give you cushion between different structures, all right, and they're filled with a fluid, right, so that there's a glide. Without that glide, these ligaments and the muscles and the bones or the cartilage are going to rub together and cause damage. So we don't want damage because damage could be inflammation, pain, tears. It could be a partial tear or a full tear. So we want everything in the joint functioning the way it needs to. Here's the synovial membrane. The synovial joints also have the synovial fluid to lubricate your joints. Inside of your joint, right here, you have something called a labrum. It kind of lines that inner joint. You could injure labrums too. You can tear those. You have labrums in your shoulder. You have labrums in your hip. So keep in mind that that can be injured as well. So here's a part of this, and it's kind of down here as well. Now, if you were to look at the side of me and cut off the tip of my humerus, this is what we're looking at here. The reason I can tell that is you're going to look for where the coracoid process is. That's always in the front of the body, right? So here's some of the tendons. You can see it connecting on that shoulder joint. So your supraspinatus up here. Remember, if you were to put the fingers around this shoulder joint, it would have the attachment points for the rotator cuff. All right, here's your glenoid cavity, the cartilage, because you need some kind of cushion there, yeah. But yeah, here's all three of those rotator cuff muscles that are on the posterior side, and your one rotator cuff muscle on the anterior side, the subscapularis. There's also some pictures of where the bicep tendon, long head is, and so on. All right. Joints. Glenohumeral, acromioclavicular. Say that 10 times fast. Here we have all the rotator cuff muscles and the triceps, cut. So these three rotator cuff muscles are cut, so you can kind of have a better view of how it attaches. All right, and then you have something called the articular capsule. So articulation means when joints, meet, right? There's going to be a capsule surrounding that, right, to keep it safe. All right, so a lot of ligaments will tell you, the name will tell you where it is, like coracoacromial ligament means coracoid process and acromion. But like I said, you don't really need to know all the ligaments. We're not doing surgery here. All right, we're done with part 2. I hope you guys learned some stuff. If you have questions, reach out, and we'll see you later.